It's not talked about as openly as alcohol and drug use, but advocates say eating disorders are also on the rise during the pandemic. It's National Eating Disorders Awareness Week. One Toronto woman is sharing her story, hoping to make the very real problem less taboo. Erin Sutherland developed an eating disorder at the age of 17 and has been in recovery since age 25. She's currently 43. Sutherland says COVID-19 makes the disorder worse.
An eating disorder is a very sort of solitary disorder. You know, it very much flourishes when you're alone. So this sort of isolation of the pandemic is sort of like a perfect storm for a person, you know, who's undergoing stress, whether it be, financial stress from losing their job, stress over COVID-19, to develop and sort of have this eating disorder really take over.
Emily Huynh with the National Eating Disorder Information Centre says eating disorder groups across Canada are uniting and have been raising awareness from February 1st to the 7th.
Eating disorders happen, 365 days a year, and this is a week where we're finally able to be in a spotlight and have an open discussion to hopefully destigmatize this issue.
The issue of bulimia, anorexia, binge eating, and other eating disorders is widespread.
There are a lot of stereotypes when we think about eating disorders, and people don't realize that it's as diverse as the people that they affect. And, so it's people of all genders, sexual orientations, ages, socioeconomic statuses, or class, abilities, race, ethnic backgrounds.
Huynh says the pandemic has created a lot of complications for people suffering or trying to seek help.
We have weight stigma and diet culture messages. It's been really normal to have decreased activity levels, changes in our eating habits and patterns, and that's normal, but there's a lot of discomfort that we sit with. And seeing yourself all the time with virtual meetings can be really uncomfortable. Support systems and treatment programs were temporarily on pause, and there was a really big backlog with wait lists. And as community-based organizations were kind of setting up their online supports, there was that small gap in service.
Huynh says continuing awareness and education is really important because prevention is the best treatment for eating disorders. Sutherland agrees, sharing this message to those struggling right now.
So I hope people who are struggling with eating disorders or eating disordered behaviors and feel alone and isolated and feel like they're the only person in the world doing this, know that they're not. Even though, yes, I've had an eating disorder since I was 17, I've really been healthy and doing well and very much in recovery, for most of my life, and that there is hope.
If you're struggling with an eating disorder or know somebody who is but don't know how to talk to them about it, head on over to netic.ca for free helpful tools. For City News, I'm Maleeha Sheikh.